Surgeon needs objective objections to our surgeries so that we can be a better surgeon. Most of us can become satisfied with our surgical techniques at a certain level, and that's the reason why training will make us a better surgeon. Ultimately, you are doing the cadaver labs, cadaver trainings, fellow trainings, all these things. Ultimately, these will be fuel. This will help you be a better surgeon. Am I correct?
Yes, of course. As Dr. Wilson tells, keep learning all the time. I learned a lot of good things from you today, and the criticism of Dr. Wilson, and it's important for me. It's a feedback because we discussed this yesterday with Ahmed and with you. If you're working alone and hide your secrets or your tricks from the other surgeons, so you're isolated as a small pond with stays water. The water will be stink if it's not runs. And I think it's very important, this living discussion and this living way of learning and improve your surgical skills.
And that's what happened to me as well. After my training in the US, I went to the US, get trained all by myself, and nobody had financial support on me. And I was out there risking me and my wife's career.
Yeah. Yeah.
I came back from the training, and I started my own practice, which was also they called as a Russian roulette. So I spent a year and a half. Luckily, my practice got successful, and I was having a lot of patients. And I was not willing to share any of my techniques to anybody else because it was a hard-earned techniques, not given for free like the others. Yeah. And then, same thing happened. Dr. Wilson came over to my practice, asked me, do I have any other trainees? I said, no, this is mine. He kicked my ass, and I was so unhappy, At first, I was so unhappy. And back then, to be honest with you, I thought that I'm a great surgeon. After, 150 or 200 cases, I feel like I know everything about this surgery. But he ushered me to share my techniques, to present papers, to go abroad, which is uncommon for the private practitioners in my country.
Okay.
So I thought that, why should I do this? Mm-hmm. And I loved, going abroad, meeting my friends, but I couldn't see the point. I couldn't make a peace with myself, something that doesn't help my practice or my surgery. But what's funny is that after those presentations and the trainings, I've become a better surgeon than before.
Of course.
The reason why I think now I get to think about it is that I had to explain my surgery to the others. Like you were explaining your surgery to the Ahmed, or you had to explain your surgeries throughout your body donor, sessions, right?
Yeah.
I think those training sessions is a training for the trainer as well. We have to objectively, think about our surgeries, right? We have to think about this process is why. Why do we this? Why do we that? Absolutely. And we have to explain ourselves. There should be a logic. Like today, surgeon comfort is important, and we use that sentence as excuses for all those craziness, right? But what we've seen today is surgeon comfort is not always something we need. We need some uncomfortable positions and objective, objections to our surgeries so that we can be a better surgeon. Because as a solo surgeon, I think we get blinded.
Yes.
Surgeon needs a courage to venture on, to jump on the case, right? But for me, what I found out is that courage also made me very arrogant as well. Humans are subject to have a hubris, unfortunately. So surgeon is a good example with that. I guess you will agree that many doctors are animals of ego.
Yeah.
We want to control everything. We want to believe that we are perfect, but in reality we are not. And that's the reason why I think for us and Dr. Wilson, training made him, and training will make us a better surgeon, because we can't be perfect. We can be better surgeon than, but not a perfect one, which I want to be, but I'm not there yet. So that's what I saw. That's what I thought with your, body donor, sessions, because you worked that hard, and Dr. Weddell also. I experienced to create something out of nothing. It's such a hardship, right?
Yes, but if you ask me the reason, as you said, we just want to help our patients and to teach our doctors. And maybe this is something I learned from our father, Dr. Wilson. He is the godfather of prosthetic urology all over the world. He has children in almost each country.
Yes.
Yeah.
Yes.
And we love him and respect as own father even more. And that is maybe one of the reasons why you shouldn't hide your secrets and your tricks, because we are all in you till end of our days. We'll say, Dr. Wilson, teach me. He is our teacher. And this is which is important, and that is what makes him great.
I guess the same thing came to me, when I first rejected the idea of the training the others. He wanted his compensation of training me as, Sean, make me proud of you, just like I do with the others. He has many good samples, including yourself. So he never get reimbursement from me. And that sentence, son, make me proud of you, becomes a curse. It was an obsessive thought, how to make him proud of me. So that's also a very good way of the leading the young bull to head into the right direction, not to run into somewhere else. So yes, like you said, I wanted to make him proud of me. So I didn't want to disappoint him by not sharing my techniques. But actually, it was after I've done it, I think he really taught me how to be a better surgeon than I do. Most of us can become satisfied with our surgical techniques at a certain level, but he taught me how to be overcoming that kind of barrier we will meet. Because every surgeon will think that he becomes great, right, after several cases. But I've seen many prosthetic surgeons leaving prosthetic urology after their start of the year of 3 or year 4, because that's when they will face complications, difficult cases, all the difficulties. Some still remaining and still struggling to overcome that, and then they become, I'd say, a great surgeon. But some just went away and doing some easy surgeries or some new surgeries. That's what I have, observed throughout the years.
Yeah, I
So-
can only confirm.
That's why I wanted to come over and see how you do the surgeries.
Thank you for coming, sir.